Hi, I'm Dr. Jeremy Suess. I work at Clackamas Smiles. We're just off Sunnyside. We could ask quite a bit what a dental crown is, what it does for a tooth, what it doesn't do for a tooth. And the simplest way really to describe a dental crown is it's an artificial covering over the outside of your tooth. So the inside of the tooth has the pulp, the nerve. The next layer is sort of a medium density, it's dentin, and the outside is really strong, and we call that enamel. We recognize that as like the armor on the outside of a tooth. If you have a tooth that's damaged, if part of that armor, part of the enamel is broken away, if it's chipped, if it's compromised, or if it doesn't have a really set and strong foundation underneath it, then you might need that armor replaced. And so in a dental term, we can remove the rest of the defect area, anything that's chipped, anything that's cracked, or anything that's broken, and we can replace that artificial outside over a tooth. It's really the armor layer. So when people ask, hey, what is a crown or what is a cap? And those are the same things. They are the outside replacement layer that goes over the surface of a tooth. When patients ask us how long a dental crown will last, the answer is it depends. One of the biggest factors is how strong the underlying tooth is. So if you have a strong root and mostly good structure, and we're just replacing or repairing the outer portion, you could expect that to last 10 years or more. Now, nothing man-made lasts forever, and eventually it'll wear and tear and chip and crack and break down, just like natural tooth structure can. But a typical crown, expect that to last somewhere in the neighborhood of about 10 years. How do I take care of my new dental crown? And I love hearing that because it tells me that the person is motivated to take care of it. They want it to last a long time. They want a good outcome, and so do we. So what we tell patients when they get a new dental crown is really treat it like you would treat any other tooth that you like, which is keep it clean and don't use your tooth as a tool. Don't bite into anything too hard or cut fishing line or sewing thread, things of that nature. And really, if you brush it, you floss it, you clean it, and you don't abuse it, it's going to last a long time just like the rest of your teeth. When we get asked if crowns hurt, what we can say is only if you're a wimp. No, just kidding. Sometimes dental work can come with discomfort. There can be things that are unpleasant. We normally don't like to talk about those, but it's necessary to fix something. It's kind of like when you go into the doctor and you need a procedure or you need a vaccination or something like that. And kids frequently ask, do I need a shot? It's hard to say, do you tell them yes? Do you tell them no? You don't want to lie to them. So when patients ask us, does a crown hurt? What we'll say is, there's definitely discomfort. Why? Because you have to sit in the chair and it's boring and we have a lot of work to do. But the reality is, with today's technology and keeping you numb and keeping things comfortable, most of that discomfort is going to come afterwards, and it's in the form of soreness. So if you're okay with some soreness and really, just getting over that post-procedure kind of slowdown that some people have, then the answer is you'll be just fine after a dental crown without anything exceptional afterwards. When we get the question, are crowns used for cosmetic dentistry? The answer is yes, absolutely. We can use crowns, we can also use veneers, and there's other things that we can use as well. Rather than talking about the specific names for each of these things, it's really important to think about what you want them to do. If I want something to cover the face of the tooth, we can change the color, we can change its shape, we can repair chips and cracks, we can make the edges even. There's lots of freedom that we have when we're changing that edge. Now, the detail comes with, well, should I get a crown or a veneer? And really, the best person to decide that is the dentist doing the work. If just the front side of the tooth needs to be changed, and the back side is in good shape, it's healthy, it's not chipped or cracked or otherwise uninvolved, then you might be a great candidate for a veneer. But on the other hand, if there's already been existing work, if there's old fillings in that area, or if just some of the damaged area goes in between those teeth, then it's most likely that you'd use something like a crown to cover the surface of it, kind of like a helmet or like a cap that fits over the top of it. So depending on the tooth, depending on the situation and the dentist, you might either need a veneer or a crown. The recovery after crown placement is really straightforward. You're nice to the tooth, you're nice to the gums. It's a little bit sore, but you're doing just fine. What we ask you to do is stick with a regular diet, clean it like you would normally clean it, floss it like you would normally floss it, and overall be nice to it. Don't use your teeth as tools. Don't bite into fishing line. Don't bite into sewing thread. But other than that, you should use your tooth like a tooth. So the recovery is really, feel free to use it as soon as you walk out the front door. Probably one of the biggest questions that I get is, what's the difference between a crown and a veneer? Can I not have a crown? Can I have a veneer instead? And the reality is, Crowns and veneers are really similar to each other, and it just depends how much of the tooth that we're covering. So if you have a tooth that's damaged and chipped just on the front side, just on its edge, you might be a great candidate for a veneer. On the other hand, if you have damage that goes around the tooth, if there's already been prior work on the tongue side of that tooth, and so many of us already have this, then instead what might be better is something that totally covers the outside of the tooth, that acts like a cap or a crown or a jacket. So caps and crowns that's the same thing. That's synonymous with each other. But a veneer is something different that really just covers the face side of the tooth. Now, the best person to determine if that's necessary is your dentist. So look at that tooth and figure out, hey, does something need to totally cover the outside of it? Or can it just cover the very front side where there's chips and cracks or maybe discoloration that we can change?